First of all, I want to support the motion and the amendments which Sinn Féin have tabled and commend the authors for moving the motion in the first instance. I think it's always a good debate to have in this House, to debate mental health services. And I want to, if I can, focus on the CAMHS service in University Hospital Waterford and the lack of facilities which exist as a part of that service. The South East lost, Minister, a number of adult psychiatrists over the course of the last number of years. One of them resigned his post, and resigned because he saw that the services were simply lacking. He resigned, I think, in protest more than anything else, and was horrified at the fact that the building itself and the level of services which were in place were not what children who need the supports of a child psychiatrist and need the support that the CAMHS service should get. The Mental Health Commission, on a number of occasions, have found that the inpatient mental health facility at University Hospital Waterford was of a very high risk. It found it was critically non-compliant with regulations relating to the maintenance of records and the use of their selection. It also found in the past, in a previous inspection, that children and adults were put into what it called a dirty and dusty seclusion room. It was not fit for purpose. We've had reports of children in adult wards. In fact, one report in 2017 of a 16-year-old girl who was left in a chair overnight in an adult psychiatric ward and was absolutely horrified at the plight that she went through, and I would imagine her family were as well. And all of that shows that there's a lack of capacity in the system. And I don't blame the Minister for every problem in the health service, no more than I blame the Minister for Health for every single problem in our health service. But when we have serious capacity issues, where the regulator, in this case the Mental Health Commission, make it known that there are serious problems, time and again, year after year, capacity problems, problems with the building, not fit for purpose, children in adult wards, a lack of psychiatrists leaving University Hospital Waterford because they can't work in the environment that they're in. We had services in Wexford which were closed. St Senan's in Wexford was closed. Patients were sent then from Wexford to Waterford. What happened? No extra capacity was put in place. Waterford became overcrowded. And then what happened? Patients right across the South East were actually told to go to Cork. And these are people who need supports immediately when they're having an episode, or if there's a risk to their life and they need to go to the hospital and get immediate access and immediate services, and it simply isn't there for them in some cases, in fact in most cases. That's reality, Minister, for many patients. So an awful lot more needs to be done, and the government needs to wake up on this issue. And again, I support the authors of the motion and support the amendments which have been moved. Thank you.